Hi, I'm Simon Wade. I'm a student of physical therapy, and today I'm doing a wound assessment for integumentary class. I'm going to use myself as a patient, but I just want to note that if I was using a real patient, I would want to have them in an elevated position, possibly seated on a high table, myself below them on a stool, so that I was using proper body mechanics to check this wound. But for the purpose of this video, I'm going to have my foot here so it can be seen by the camera. I've got my clean setup behind me here with a new applicator and disposable measuring ruler, and my new gloves that I'm going to make sure not to cross-contaminate throughout this. So the first thing I can do when I'm looking at this wound is I can check the location of this wound. I see right away that it's on the dorsum of the foot and on the lateral side. Now that I want to look at the wound, I can check the size of this wound. I can use my applicator to do this, and I can do the length and the width of this wound. That's 3 centimeters long. I could check the width very much the same way. I have a 3 centimeter width for that wound as well. Next, I want to check the depth of this wound. I'm going to take the tip of the applicator, find the deepest part of the wound. Sorry if I'm covering the camera. And then I will press it in there and pinch off at the base. And I have 8 millimeters, 0.8 centimeters for depth. Now that I have the location and the size and the depth of this wound, I can look at the color of the wound. What am I seeing inside of this wound here? So it's not a vivid red. It doesn't look like there's a lot of blood flow going to this. It's actually a rather pale pinkish red. And there's some yellow slough going on in there and some black necrotic tissue as well. I'm gonna want to figure out the percentages of that. So I'm gonna say this is about 50% pale red and 25% yellow slough and 25% necrotic tissue as well. From there, I'm gonna want to move towards the outsides and check what the edges of this wound are like. And it looks quite dry and punched out to me. I want to check the shape of this wound as well. It's round. It's a round, dry, punched out wound. And from there, probably the first thing I would have seen when I undressed this wound is what the drainage was like. So I want to talk about that now. In this case, I said it's dry. There's not a lot of drainage going on with this wound. And so I can move from the outside of from the edges of the wound to the peri wound here and see what I'm seeing. I see it's a bit shiny. I don't see any hair here on the top of the foot. There's actually a toenail fungus going on, and it looks like some athlete's foot as well. This is definitely a sign that there's a lack of blood flow going on here. Next, I'm going to want to check temperature of the peri wound. To do this, I will feel the peri wound, but I'm going to need to compare it to the unaffected extremity. And I can feel it's quite a bit cooler than the unaffected extremity. So I have the location, the shape, the size and the depth, the edges, the peri wound characteristics, cyanotic. I want to mention there's some signs of darkening distal toes going on here, possibly some necrotic gangrene starting to accumulate here. I've talked about the drainage. Next, I want to talk about pulses and special tests I'm going to do. I would want to start proximal and work distal with my pulses to see how the pulses progress and where they are and are not palpable. If I thought this was quite severe, I could start up at the femoral and work my way to the popliteal and then the tibialis behind the medial malleolus here. So let's say the tibialis is a 1+. I'm also going to want to check the dorsalis pedis between the first and second metatarsal. And in this case, let's say that's absent. I can't even feel that one. Special test I'm going to do for this patient is going to be an ABI. We want to see if that's above or below a 0.5 for healing potential. And then the last thing I want to look for is any signs of infection. I do also want to check the odor actually, but for signs of infection, I'm looking to see if it's warm, pus, and inflammation going on, and I don't see any of those things going on, so I don't see any active acute infection going on. For odor, I'm going to want to waft towards myself. Don't want to put my face into the area, and I get a slight necrotic smell to that. So to recap, I have the location of the wound, I have the size and the depth and the edges, peri-wound characteristics, the pulses, the temperature, the drainage, I asked the patient if there was pain or not. Signs of infection I checked for as well. And color, which we discussed in percentages. And that was everything. Next, I'm going to do documentation.